Okay, we're gonna go through the steps on our treatment room decontamination and disinfection. So we're coming into an operatory as though the patient has left for treatment. They've already had their appointment, they left out to the reception area, and then you come back into the room to go ahead and tear it down and disinfect. So the first thing you're gonna need is a transport container that we use here in our clinic. This is kept under the sink in sterilization on the dirty side. And you will also need these utility gloves that are also kept next to the sink on the counter on the dirty side. We wash these, but you still want to wear a pair of clean gloves inside of these when you use them. There's different sizes. There's medium, small, and large. So you're going to slip them over your clean gloves. Make sure your cuff of your glove is up and over your gown. And then the first thing we're going to do is remove any of the disposables from our operatory. So like our patient napkin, the suctions, the headrest cover, the tape that covers our light and the chair. So we're going to go ahead and do that first. And you can use the headrest as almost like a little garbage for you as you're removing those barriers and disposables. There's also tape barriers on the doctor's stool and the assistant stool on the lever here, so don't forget those. On the foot lock down here as well, you want to take that off. And then the keypad, the HVE, your suction, the slide ejector, any disposables that are on the tray itself, like 2x2s, gauze, floss, those are all disposable. You're gonna put them in your garbage bag there. This paper that we use to check bite, it's called articulating paper. You're gonna throw that in the bag. And then you can put all your instruments on your tray. Things like the patient glasses, a napkin, clip can all stay on the counter here. All right, then I am going to throw this away. And next, I'm going to grab a disinfecting wipe. It's hiding way back here. You can grab a couple of them. And we are going to wipe down and remove the burr that's in our high-speed handpiece. Sometimes there's debris that can get on those, so you just want to wipe that off first. And then you're actually going to flush, meaning you're going to step on the rheostat and have the water go into the HVE with the burr in place for 20 seconds. So you'd turn it on, step on the rheostat, and the water you're going to have go for 20 seconds. Okay, we're going to say that's 20 seconds. And then you can take the burr out of the handpiece. It just flips up in the back, this little lever here, and then the burr you can pull out, and then it goes in this little burr block here, and then you can detach the handpiece from the hose. You just unscrew right here, set it on the tray, and this can go back on the holder. The slow speed is this one. This one doesn't have the fiber optic light or water, but we still want to wipe any debris that gets on the burr itself before you take it out of the handpiece. And then this one, you just push the back of it and pull the burr out. And then same thing, it detaches down at the hose. And then we put this on our tray. Our air water syringe tips, we want to flush those, same idea as the handpiece. So you turn on the HVE And then you spray for 20 seconds. Again, that's just to flush out any debris, film, microorganisms. And then you'll take your tip out. We'll do the same thing on the assistant one. Again, we're going to say that's 20 seconds. Turn off the HVE. Take off the tip. And then now you're going to take your instrument tray and place it in your transport container. Last thing I do want to take out of here is if there's any sharps containers, so like the syringe needle, you're going to place that in the sharps container that's in the room, which is over by the amalgamator. And this little matrix band, you guys will learn about that. This is also considered a sharp, so we'd place that in the sharps container. Then you're going to put the lid on and secure the ends. And at this point, we would walk in, or you're just going to set it aside, because we're going to do our first wipe down of all of our hand pieces, hoses, the air water syringes, the countertop, the chair, and this is considered our first wipe. So we're going to do that now that the tray is set aside. All right, so now that our tray is set aside, you're going to grab 2 to 3 of the disinfecting wipes. And this first wipe that we call is the decontamination. So this is the first wipe. We do a wipe, discard, wipe technique. So this, we're just removing any of the, bacteria and microorganisms, cleaning, disinfecting the room after patient's treatment. So you're going to wipe everything down one time, place it back on the tray, because we do come back and do a second wipe just to make sure that you get everything clean and disinfected. And then regarding our hoses over here, our kind of non-verbal technique is you're going to wipe down each hose. Start at the top, go all the way down, and you're going to lay it over the back of your operatory chair. That way, in case you happen to walk away or need to take your instruments to sterilization, someone comes along to help you, they know exactly what stage of the process you're in. They're not guessing, is this room wiped down? Is it still dirty or anything like that? So this is what we choose to do. So you wipe all the hoses down, lay them on the chair. Same thing with your suction and air water syringe on the assistant side. Make sure you get the toggle, turn it on and off, clean under that. And wipe the hose down, and the air water syringe, the buttons, and down the hose, and the HDE around the toggle, and down the hose. You also do want to wipe the little holders. I call them the holsters for each of those. Bar here. And same thing on the doctor's side, the little holders down in between there. Okay. Then you give your chair a good wipe down, the armrests. I would still wipe the handles of the light, even though there was a barrier. Sometimes the barrier doesn't fully seal it. Same with the toggle on the light switch. And then if you happen to touch any part of the bar or the arm bracket here, you need to wipe that down as well. And I'm going to come around here and wipe your assistant chair. Again, you're touching this during treatment. And then if you use the amalgamator, you would wipe that down. You'd open it up and wipe it down. If you use the curing light, you need to wipe that down as well. And then last thing is our doctor's stool. I'm going to wipe that down as well. All right, so no one's usually perfect on your first wipe down of a room. That's why we do a wipe, discard, wipe. So we let this sit for 5 minutes after we've wiped it down, decontaminated. At this point, you would take your transport container with your tray into sterilization to break down the tray. And then you're gonna come back. When you drop off your container, you take your gloves into sterilization. We're gonna show you how we wash those. Okay, so we've brought our tray and the transport container into sterilization on the dirty side. So now at this point, we are going to wash and clean our utility gloves. So this is why we have the sign on here. Do not use with bare hands because it is dirty. We use it to wash our utility gloves. So don't use it with bare hands. So get your gloves wet with them on your hands, just like you're gonna wash your bare hands. And you're gonna just wash these here. And rinse them really well. Okay, and then now we're gonna take them off. Again, we still have our regular gloves underneath. You do wanna take the disinfectant spray here and spray them both sides. Get a paper towel, and then we're gonna just lay these flat on the paper towel to dry. Go ahead and take your gloves off in sterilization, because when we go back into the operatory for our second disinfecting wipe, we're gonna put new gloves on. All right, so now that we dropped off our tray, we're back in the operatory and we're gonna do our second wipe, the disinfecting wipe. So you're gonna come in, get new gloves, and then you're gonna grab 2 to 3 disinfecting wipes. And we're gonna go through the whole process again. We're gonna wipe down all the surfaces of the table, the patient glasses, the napkin clip. So once you do the second wipe, go ahead and place the clean items on the back part, so we know that they've been wiped 2 times and they are good to go. And then before we wipe down the hoses, let's wipe the holders a second time. And we're gonna take these. This is important not to get everything tangled up when you're wiping them down the second time. So you wanna place them back in the correct holder, but also not get them twisted and tangled. And same thing with the handpiece hoses on the doctor's side. Let's wipe those first. And same thing, don't get them all twisted up. The nice thing with these, they are color coded, so you know exactly which hose goes to which holster, like I call them. All right. I'll wipe down the doctor's stool again. Patient chair. The armrest down. And the assistant's chair again. And the light here. And remember, if you touch the arm, you gotta wipe it down a second time as well. And then if you wiped or touched and used the amalgamator, make sure you lift that open. Wipe all the surfaces of that too. Okay, so now our second wipe is done. Now we are ready to, we can remove our gloves, throw away and discard your disinfecting wipe. And then we're going to go through the process to put new barriers on. All right, so for our barriers, you're gonna grab the roll of tape. Each operatory has its own. So you're gonna take, with bare hands that are clean, we're gonna place tape over our keypad here. When you guys place tape on the light handle and the toggle, what I think it's easiest to do is grab 3 at a time. And instead of placing them on like this, because it can be really hard and stick to the handle, what you're going to do is fold the top portion of the tape. So it's folded like this, and then you're going to rip one off at a time and place it on each of the handles. This just helps it, it's easier to remove if you fold over the tape instead of not folding it. And then push that out of the way. And then we're going to place tape on the doctor's levers on the stool. Same idea. Make sure you fold the tape. So again, easy to remove. And another one here. And then one more on the assistant stool. Again, we put tape on those levers just so in case you need to adjust them during treatment. And then your headrest covers for the chair is in the same drawer as the patient napkins. You open that up, slide this over the headrest here. And last barrier we're going to place is on your foot lock lever here. All right, and that is